and welcome to another fun episode of Fun Facts at the Pharmacy. I'm your host, Dr. Christopher Greider. The purpose of this show, if you've never watched it before, is to give you guys basic health information to make the best calls in your life, even if a pharmacist or a doctor or another healthcare provider is just not available for you. That way you guys can make the best decisions. So, to kind of start things off, we normally start off with a little basic 5-minute segment that kind of covers something going on called fast acting. For today's, actually, what we're doing is for the month of February, because it's the wonderful month of love and Valentine's Day, one of the biggest things from pharmacists is that we try to make sure that people are taking their medications. And what you may hear the term is adherence. During the month of February, we actually have an awesome event that goes on for all the pharmacy students called Script Your Future. The purpose of that is just to kind of help people understand the importance of adherence. So to kind of help me out today to kind of talk about that is I actually have a student from Neomed. His name is Dominique. So Dominic, nice to meet you.
Thanks for having me today.
Yeah. So what can you tell me about Script Your Future?
So Script Your Future is a campaign nationwide where students go out in the community and try to have FaceTime with patients and talk to them about their medications and how they could be better taking them.
Oh, that's awesome. So you guys are trying to get your faces out there to pretty much get more communication going on. So.
Exactly.
Okay. Yeah. How important would you say from your standpoint is adherence for a lot of people for taking their medicines?
Yeah, it's a big issue that the community has, and it's very not well known. 3 out of 4 patients tend not to take their medications correctly. So what we're hoping is to explain this to the patients and give them different strategies on how they could be better doing that.
Oh, perfect. So you guys are trying to just forefront the idea of like you need to make sure that you take your medicines. Now, I have some patients of mine that actually don't always take their medications like they're supposed to. What are some things that you guys help to talk to them about that really kind of pushes for that?
So we have cards that you can track your medications on, pledges that you can say, I will be taking my medications correctly, and kind of help you focus in on that. We can also give you guys different pill containers, whatever it helps to organize your medications too.
Yeah, so you'd say just a lot of memory aids, things like that to kind of help. So perfect. Are there any like real concerns that you can think of if people miss their medications? Yeah,
a lot of times patients think that they're not feeling poorly, so they don't take their medications because they don't see a need.
Okay.
So that's one of the things we like to address is that even though you feel okay, it's still important to take your medication to help prevent anything later on.
Okay, so it's always important just to make sure that you're keeping with it on a consistent basis.
Right.
Perfect. So with this campaign, you know, it goes national. Are there like any major events that you guys have coming up or anything that's going on that people can come out there and talk to you guys about?
Yeah, so this month we'll be going to the Great Lakes Science Center, visiting a bunch of people there.
Yeah.
We'll be in your local pharmacies like Klein's, and we're hoping to be at a couple health fairs too.
Perfect. With these health fairs, are you looking more towards like the school areas, or where are you going for those?
We'll be branching out. There's some in the greater Cleveland area that we'd like to go to.
Okay.
You know, just talk to some people, give blood pressure screenings, have some coloring contests for kids, you know.
Oh, perfect. So a little bit of everything for the whole family, so to speak. Okay. Yeah, and if I'm not mistaken, you guys also have kind of like a pill counting competition where people can possibly win, you know, like a gift card or something like that?
We do indeed.
Okay, perfect. Well, that's awesome to hear. Is there any particular site that people can go to that they would be able to kind of check out and see what these events are and when they're going on?
Yeah, so if they go onto Facebook, they can look up Neomed Script Your Future, and they will be able to look there and see specific dates and times of what we're doing and when we're doing it. So
yeah, well, that's awesome to hear. I'm glad you guys are getting into the community, kind of helping to drive the importance, because that's, like I said, that's one of the biggest issues that I think I deal with a lot of patients.
Right.
So the main thing right now, I would say, is if anything, just make sure that we're having you guys go out there and talking to some of our even fellow students that are going to be pharmacists here, and that way we can get you guys going with all that. So, well, Dominic, thank you for stopping in today to talk about that.
Thank you for having me.
Thanks. All right, so continuing on to the main portion of our show today, the main thing that we wanted to cover on this episode for you guys was high blood pressure, or as some of your healthcare providers might call it, hypertension. So the main thing about high blood pressure is with the holiday seasons and everything going on, people tend to overeat, which can cause their blood pressures to naturally go up. So to kind of help me talk about this topic today, I actually have one of my students here for the month. His name's Tom. Hey, Tom.
How's it going, Chris?
Good. So do you want to tell the audience a little bit about yourself?
Sure. My name's Tom Russo. I'm a final year pharmacy student, and I go to Northeast Ohio Medical University located in Rootstown. And myself, I am from the Youngstown area.
Perfect. Thanks. So kind of just talking about everything that's going on with high blood pressure here. what is high blood pressure exactly?
Okay, that's a good question. So high blood pressure is basically when the pressure of the blood flowing through your arteries, your veins, we'll just call it your vasculature. That's just the pressure of all of that flowing through your body when that's higher than it should be. And we'll get into a little bit here where that actually should be and those numbers you should be looking for. Yeah. So basically high blood pressure is, as you said, hypertension, another word for it. When the pressure is higher it needs to be. There's different components that go into your blood pressure. Things like how fast your heart is beating, how much blood your heart is actually pumping out. And then when it comes to your arteries and your veins and your vasculature, that can actually expand and contract, and that can cause resistance to the flow of blood. And that is another big component of blood pressure as well. So all these different things go into what your blood pressure ultimately is in the long run.
Yeah. So would you say like the way that your blood pressure functions is kind of like a hose, so to speak?
Yeah,
so.
That's a very common analogy used as a hose. So yeah. Of course, if you have a hose, you got water flowing through it, and you crimp the hose, it's going to be flowing the water out at a much higher rate, or not much higher pressure in this case. So
gotcha.
Yeah, that's an excellent analogy for people to remember their blood pressure by.
Yeah. How many people are typically affected by high blood pressure?
So this is actually one of the most common cardiovascular conditions that affect the U.S. population. About 1/3 of the population has high blood pressure, and there's another significant portion of those who are actually classified in a category that puts them like pre-hypertensive. So they're like on the border of being diagnosed with having high blood pressure.
Gotcha. Yeah, I would safely say high blood pressure is probably one of the biggest things that leads to one of the biggest causes of essentially death in the U.S. as well. So whenever you hear of people having heart attacks and strokes, sometimes this is kind of the precursor. It's something that leads into these possibilities. So that's why we always want to pay attention to it. And with so many people impacted, we don't want anything bad to happen with our patients. It's something that we definitely want to touch on, if anything. So
yes,
perfect.
Exactly.
Yeah, just kind of going out of that then, there's different things that can actually impact how our blood pressures typically go. So some things can cause them to go high, some things can cause them to go low. So what really causes our blood pressures to change?
So there's different things that actually, affect your blood pressure. Your nervous system plays a big role. There's different hormones that can cause it to go up and go down. And then, of course, a big thing is your kidney function, how well your kidneys are actually filtering your blood. And filtering out salt is a big component. A basic like theory of the blood pressure is that if you have excess salt, the water is going to follow the salt, and you're going to hold on to a lot of fluid, and that's naturally going to raise your blood pressure that way. So kidney function is a big thing when it comes to blood pressure as well.
Yeah, and kind of just to touch on that a little bit more too is essentially the position of our bodies plays a role in it too. So as we get older, the biggest thing that we ever run into is that when you start going from sitting down to laying to standing, our blood pressures naturally have to adjust and change accordingly. But sometimes it takes us a little bit longer. So I always tell people is just, especially when you're older, whenever you're changing positions from sitting to standing or even from laying down to sitting, give yourself a little bit of time in between too, just to make sure, even if you can give yourself maybe 15, 20 seconds so that your body can kind of readjust to it. The worst case scenario is if you just try to leap out of bed and you're running around as an 85-year-old. I mean, it'll be impressive if you can do it. I'll give you that, that's for sure. But sometimes if your blood pressures can't adjust, you can feel a little dizzy or have some problems with it. So yeah, right. That would be something else that can kind of impact it there. When we're talking about blood pressure effects, I mean, we're always concerned that our blood pressures are either too high or too low. So just kind of looking at it, I mean, what are some of the short-term effects if somebody's blood pressure was too high?
So if your blood pressure is just a little high, I guess, it's really, you're not going to really feel a lot of signs or symptoms. And that's another reason people think, well, my blood pressure is a little high, what's the big deal? It's not really so much as what you feel like in the short term. It's, again, those long-term effects. Having high blood pressure, that's a major risk factor for developing a heart attack or stroke. So these things can be potentially fatal down the line. So it's important to manage your blood pressure now. But going back to the short term, you're only going to really feel any kind of symptoms if your blood pressure goes really, really high. And you'll be feeling things like a really throbbing headache, potential vision changes, and even some dizziness or some common things if it goes too high.
Yeah, and one of the other things that I always tell people to look out for, and it's not you have to have the other symptoms that you just mentioned, but even like nosebleeds are always a possibility. So if you start to notice anything unusual where you're feeling dizzy, like you mentioned, but then you're also having a nosebleed with it, that could potentially mean your blood pressure is just skyrocket high right now. And like you said, yeah, we'll kind of talk about it here in a little bit just to let everybody know what common blood pressure readings are because there have been some changes. So what everybody used to know it for has been different now. So when we're talking about long-term effects, I know you talked about a little bit about like having strokes and heart attacks. Is there anything that happens with your kidneys too when you're doing that?
Sure. Having just elevated blood pressure over time, it's definitely going to take a toll on your kidneys. They can impact how well they function and can eventually lead to chronic kidney issues. So that's another major complication of having high blood pressure, one of those kind of like long-term effects. And in addition to the heart attack and stroke, there's other things, even like heart failure and even issues with your eyes that could happen as well.
Gotcha. Yeah, so we always want to make sure that people's blood pressures are staying within a set range because that can lead to a lot of problems. So kind of touching on that right now, I mean, like I mentioned, there have been some recent changes in what they consider to be normal blood pressure readings. So they have healthcare providers that always get together almost every year that kind of talk about it and they collaborate and they, there's nurses and physicians and pharmacists and other people involved that really try to hone down like what's considered good for the general public. So in your research of looking over stuff right now, I mean, what are the current guidelines looking at? Like, what are we supposed to be aiming for our blood pressures?
Okay. Well, at the end of 2017, the American Heart Association and the American College of Cardiology came up with new blood pressure targets for the populations. So before I get into those, your blood pressure is measured in two numbers. There's going to be a number over another number. That top number is known as your systolic blood pressure, and that is the pressure anytime your heart is beating. And then the bottom number, that's known as your diastolic blood pressure, and that's your blood pressure when your heart is at rest. So both of these numbers are very important, and it's important to try to target, a blood pressure within these certain ranges I'm about to lay out for you right now. So normal, that really hasn't changed. That's typically 120 over 80. That's been the normal for some time now, and that hasn't changed with these new guidelines. A systolic 120 to 129 over a diastolic less than 80. This is now known as elevated blood pressure. Previously, this was known as pre-hypertension, but now this is classified as elevated. Now there's stage 1 hypertension, which is systolic 130 to 139 over a diastolic 80 to 89, so that's stage 1 now. And then stage 2 is anything greater than 140 over 90. So basically with these new thresholds, more people might be classified with having stage 1 hypertension, but that doesn't necessarily mean they might need more medication. So there's different things that'll go if you need medication or not. There's different factors to consider in your medical history.
Yeah.
So those are your blood pressure, your new blood pressure ranges as of 2017.
Yeah. The one thing that I typically have whenever I'm working at the pharmacy is that people always come up to me and they'll say that my blood pressure reading, when I ask them, what the last one was, they always tell me it's 120 over 80. And I find that funny because I'm just like, that's what every guideline has ever always told what a normal blood pressure reading is. So it's kind of interesting now that they've changed it and revamped it, because it used to be previous to this, it was 140 over 90. So either you had it or you didn't. That's how they kind of classified it. So it's kind of nice to see them go back and to say, these could potentially be factors and we want to be on the safe side based on what your blood pressure is doing now. The one thing that I always like to tell everybody too is that with your blood pressure, as you do get older, it does start to naturally go up a little bit. So one thing I always like to warn people about is if your blood pressure readings seem a little bit on the higher end, but say you're over the age of 65, so if you're like 70, 75, 80, anywhere within there, your blood pressure readings may go up or they may be down a little bit. Ultimately, as long as we're keeping it as close to that range as possible and it's not fluctuating, that's typically a good sign for us at least, because that means your blood pressure is not trying to jump up and down. When it does that, that's more of a health concern, and we definitely want you to go in and get your doctor to check that out to make sure there's nothing else that we need to do for you first. because there may be medications or things like that that you may need to help kind of keep it level so it doesn't cause you any major problems right now. And kind of just touching on what we already said with the heart and the kidneys, we always want to make sure they're functioning because your whole body works as a dynamic, so everything needs to be working together. If one part's thrown off, the other parts of your body try to make up for it, and that can lead to a lot of other health issues that we don't want you to have to deal with as you're going through life. So kind of touching on that, when we're talking about with these guidelines, people's blood pressures are running high and they're having problems, kind of looking at with non-medications for right now, what are some things that people can do to kind of help bring that back down for them?
Okay. Yeah, so non-medication options are recommended for anyone who has an elevated blood pressure and anyone really who's concerned about just their overall health and want to keep their blood pressure within the normal ranges. So some big things that are currently recommended are weight loss. So the AHA says about for every 1 kilogram or about every 2 pounds or so, every 2 pounds lost is actually about a 1 point reduction in your blood pressure. So weight loss can make a huge impact on your blood pressure. Another big thing is maintaining a healthy diet. One of the current diets recommended out there is known as the DASH diet. This stands for Dietary Approaches to Stop Hypertension. And this is a diet really focused on fruits, veggies, low-fat dairy products, like whole grains, and just cutting out saturated and trans fats.
So as you can kind of tell from the image that we have right here, so there is a picture that we have for you guys to kind of look at this DASH diet, because it is highly recommended for everybody that does have hypertensive problems and they're trying to keep it under control without jumping to medicines. Can you give me a little bit of an example of what's going on with this picture here?
Sure. We'll start in the little section right above the heart. I think it's a yellow color. So they recommend 4 to 5 servings of nuts, seeds, and legumes, which to my understanding are like beans, that kind of thing. Less than 6 servings per day of lean meats like turkey, chicken, and fish. Just moving again clockwise around this image. Less than 5 servings per week of sweets, so no cakes, no brownies, none of those sweet snacks. Less than 2 to 3 servings per day of fats and oils. Now, some fats and oils are actually healthy. Your body needs some fats and oils to function normally. It's those trans fats and those saturated fats you need to cut out. But there are some healthy fats like your omega-3 acids. You'll probably hear that thrown around when it comes to dietary products. You want to get some of that in. So about 2 to 3 servings per day of that. And then, of course, the low-fat dairy, 2 to 3 servings a day of fat-free or low-fat. And then, of course, 4 to 5 servings per day of fruits. 4 to 5 servings per day of veggies, and then 6 to 8 servings per day of whole grains. So these are things that are high in fiber, so not like your white breads. You want to go for like whole grain, those kind of products there. So that's basically what the DASH diet entails.
Okay, so we're trying to essentially cut out a lot of the extra fat and a lot of the extra, things that have sodium, things like that, that could cause problems.
And that brings me to my next point. Another huge thing on blood pressure is your salt intake, which we kind of mentioned earlier. Currently recommended to limit your salt intake to less than 1,500 milligrams per day. So I think we have another picture here of some high sodium containing foods. These are just some examples here. You'll notice a lot of processed foods, a lot of canned foods, some smoked meats, soups, sauces and seasonings are huge. Pretty much anything with maybe preservatives, that kind of thing, food you store for a while, there's a lot of salt in that. And of course snacks like chips, pizza, a lot of things that might seem tasty but will definitely affect your blood pressure in the long run.
And as I know, I imagine most of us are pretty guilty of everything on that list. We've consumed it at some point at one time or another. So yeah, definitely with the patients that are at high blood pressures right now, we always want to make sure that they're keeping them low. Another word of advice, this is something that I always get asked questions about, and it's something that does come up. When you go out shopping and you're looking at the labeling that's on the front of the box itself, you always have to make sure that you're paying attention to the sodium products in it. So if you look at the labeling, it'll tell you how much sodium is in per serving. Now, when you read it, some of the labels will state less sodium and low sodium. I always get the question of what's the difference. Less sodium can mean that there's 1 milligram less of sodium than what their normal container would have in it. So that's classified as less because there is less in there, but it's still really bad for you. The products you want to try to aim for if you need to go that route is low sodium. What that means is for every serving size, and this is according to the FDA, there's less than 140 milligrams of salt. Now, when you're talking about it, and how Tom just mentioned, it's the 1,500 is what you're supposed to take in a day on these diets. It does make it difficult, but if you do find those products, it does help to make it a little bit easier to manage, so you're not worried about it as much. But make sure that you're always aiming for low sodium or no sodium in the containers, and just make sure you're reading your food labeling packages, because they made them larger now from what the FDA had indicated they want it done. So, perfect. How about in regards to anything else? Is there anything else that people can do?
Of course, increase your physical activity. This kind of goes hand in hand with weight loss. They recommend aerobic exercise, and this is just a fancy word for any activity that's going to get your heart rate up. It's going to increase your heart rate. So some examples of this are like running, swimming, biking, and they recommend like moderate intensity. So a lot of people say moderate intensity means you can't really have a conversation while you're doing the activity. So like if you're jogging on a treadmill, it should be difficult to actually talk to somebody while doing it. That kind of intensity with those activities. Okay. And besides physical activity, consuming alcohol in moderation. So this means less than 2 servings of alcohol per day for men and less than 1 serving per day for women. And a serving of alcohol, it's different based on if it's beer, liquor, or wine. So 1 12-ounce beer counts as 1 drink. 1 5-ounce glass of wine counts as 1 drink. And then a 1.5-ounce shot of liquor, that also counts as 1 drink. So also good to help lower your blood pressure by consuming that in moderation. And then, of course, we recommend this for any of our patients who are smokers. Just try to quit. There's numerous health benefits when it comes to quitting smoking. And since we're focused here on blood pressure, there's a huge impact on blood pressure when it comes to smoking. So there's different options available, and this could be probably a whole new TV show, but just real quickly, there's like counseling available, there's nicotine replacement products, there's even prescription medications that can help you to curb that habit, and this will make a profound impact on your blood pressure.
Yeah, and the one thing, if anybody is interested out there of actually quitting smoking, they do have a hotline that actually does help out significantly. It's 1-800-QUIT-NOW.
Right.
So if anybody is ever interested in quitting to help either lower blood pressure or for the benefits for your heart and your lungs, please make sure you contact that number if you have no other resources or you can't get in to see a doctor. They help out significantly with that. So now that we kind of talked about a little bit of the ways to go without medicines, some people, and a large majority of people, actually need to use medications to help lower it.
Right.
So kind of touching on that just a little bit, I mean, what medications are out there that really help with your blood pressure?
Okay. There's numerous categories of blood pressure medication, just because each category works a little differently in different parts of your body to help lower your blood pressure. Depending on how high your blood pressure is, you may need one or more of these agents to help get a tight control on that. So our common drugs out there are firstly your ACE inhibitors. A common example of this medication is lisinopril. Another class are known as ARBs. A common example of this is losartan. There's also thiazides, which are a type of diuretic medication, which essentially make you urinate excess liquid out of your body to help lower your blood pressure that way. And a common example of this would be hydrochlorothiazide. There's also calcium channel blockers such as amlodipine, and then you can also see beta blockers used as first-line agents to help lower blood pressure, and this includes things like metoprolol and atenolol. Those are some common beta blockers you can see used to lower blood pressure.
Yeah, pretty much because there's so many different classes. I mean, you're dealing with different medicines that either impact, the blood flow, they're impacting the heart rate, things like that. So we always have to be careful. With the agents that are being used, your ethnicity does play a role in this. So it is something that if you have any questions or doubts, please talk to your doctor or pharmacist about it, because we can help you out with finding out the right treatment for you. But anybody that's of an African American descent, actually your treatment guidelines are much different than anybody of a Caucasian or Asian background. So if you have doubts, if you have questions or concerns, make sure you're talking to your doctor to find out what's the best treatment and what's best for you. Kind of talking about with the medicines, there are some different side effects that can occur, but what, in general, with your blood pressure medicines, what are some things people should look out for if they're starting a new medicine or if they're having an increase in their dose?
Sure, it's a great question. So anything that works to lower your blood pressure has a chance of lowering it a little too much. So a big side effect is, they call it hypotension, so low blood pressure. Some common signs of this would be like dizziness, weakness, and like we mentioned earlier, getting up from like a seated or laying down position, just sitting up like that, feeling those symptoms, those can all be a part of low blood pressure. Anything that works on the heart, if you slow down your heart, you'll have some similar symptoms of like dizziness, just general feelings of tiredness, that kind of thing. A lot of these affect various electrolytes in your body, like sodium, potassium, magnesium, calcium. Some will send electrolytes up, some will send them down, and there's just different signs of that too. So it's important to get blood work done when you're on these kinds of medications. Other than that, anything that works to like increase the amount of fluids you put out from your body, you're going to find yourself going to the bathroom a little more. Some medications cause things like photosensitivity, maybe some swelling. Cough is side effect associated with our ACE inhibitors, so that's something to look out for as well. So just those are, I'd say, would be some pretty common side effects of these blood pressure agents.
The one thing that I always tell all the patients too that come and visit me is you also have to understand, like with these changes, it's your body readjusting to a different blood pressure. Because for some patients, their blood pressures have been high for years now, and their body's so used to functioning that way that it's trying to adjust to it. So some of the side effects that we're talking about, so if you feel a little bit tired, we're not talking leaps and bounds, but a little more tired than usual. If you're dealing with a little bit of a headache, there's a possibility that once you start on the medications, after about a week or so, those side effects can start to go away, which makes life a lot easier for those people. But there are certain issues that we run into. So if you're dealing with really bad dizziness or even that cough that you had mentioned that can happen, those are good things to talk to your doctor about, because we may have to switch your medications around or change the dose. So if you ever deal with any of those, please talk to your healthcare providers to figure out what's going on so that we can adjust your medicines to be the best fit for you. Pretty much that kind of covered everything right now. Was there anything else you wanted to finish with here, Tom?
Well, I'd say just some take-home points, I guess. It's important to get your blood pressure checked at least annually. If you haven't had any issues with your blood pressure, it's good just to stay on top of it. If you've been diagnosed with any kind of stage 1, stage 2, even like elevated blood pressure, you need to get it probably checked a little more frequently than once a year. So just arrange your appointments with your doctors as you see fit and as they see fit. Start implementing these lifestyle modifications now. So anyone can do these. It could be tricky at first, but with a little motivation, adopting a healthy diet, increasing physical activity, losing weight, these will all help to lower your blood pressure and reduce your risk of those serious events later down the line. And of course, if you have any further questions regarding high blood pressure, any of the meds involved with high blood pressure, feel free to contact your doctor or find your friendly neighborhood pharmacist, and we'll be more than happy to answer any questions regarding any of those topics.
Perfect. Well, I think that kind of summed up everything for this evening. So for the end of this episode, if you guys have any questions or any doubts, make sure you're talking with your healthcare providers. We're the #1 resource with all the current material to try and help make everything as best for you and to make sure that we get you back up to where you want to go and what you want to do in life and that you're functioning at your best. Besides that, everybody have a wonderful Valentine's Day. Make sure you're not trying to go out on Valentine's Day because it's going to be hectic, and make sure when you're out there eating that you're not eating too much salt, of course. But until next time, thank you guys.